Hello and welcome back to GP Video Podcast by Nadia. So in this podcast, I will continue with talking about bipolar affective disorder. Bipolar disorder is a serious lifelong mental health condition which features pronounced mood swings. As we discussed yesterday, two extremes, mania and depression. The condition was formerly known as manic depression. The Australian Bureau of Statistics reports that the condition affects around 2.9% of Australians aged 16 and over, or 568,000 people. According to the Black Dog Institute, a leading research body based at Sydney's Prince of Wales Hospital, bipolar disorder is largely inherited through genetics and can be triggered by factors including stress, pregnancy, and illicit drug use. Typical treatment for bipolar includes medication prescribed by a psychiatrist, psychological therapies such as counseling and education for families and friends. Although there is no cure for the condition, as there is no cure for attention deficit hyperactivity disorder, it can be well managed, and people who receive the proper treatments are generally able to work, have families, and participate in all aspects of community life and do everything normally. Okay, so this was about, I got all of this that I just read from Bipolar Australia. So this was a very nice disclaimer to give you about the introduction of bipolar. Now we will go back to the definitions that we were doing yesterday about bipolar. So bipolar disorder is a mental health condition that affects a person's day-to-day interactions, behavior, mood, energy, and thoughts. Also ability to focus. I said yesterday that usually in adults, ADHD and bipolar can coexist. And when a psychiatrist is exploring a patient for his psych condition, he should evaluate if he's coming close to the diagnosis of ADHD. He should also evaluate the patient for bipolar, and if he's coming to the diagnosis of bipolar, he should also evaluate the patient for ADHD because some of the features can be really overlapping. So, for example, in ADHD, as you know, there is impulsivity, being hyperactive, and inattention that could also exist in bipolar. But bipolar has mood disorders as well, like severe depression, mania, or hypomania. So we'll have to. So it's very common for bipolar and ADHD to coexist as well. There are three different types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymic disorder or cyclothymia. All three types cause symptoms of either mania or depression or both. Some examples of manic symptoms are usually very high energy, talkativeness, distractibility, and less need for sleep, always being very attentive. Some examples of depressive symptoms are the opposite, are feelings of extreme sadness, lack of energy, lack of emotions or motivation, hopelessness, and guilt. The difference between each type of bipolar disorder comes down to when they begin and how severe the manic and depressive symptoms are. So bipolar 1, please always remember, begins around the age of 18, although onset can occur at any point in someone's life. A person with bipolar 1 disorder will experience manic episodes that are present for at least 7 days in a row and can be so severe that the patient may require hospitalization. The person may also experience major depressive episodes or symptoms, although some people with bipolar 1 may only experience mania without any depression. So, what are the requirements to be a bipolar 1 disorder? Number one, usually occurrence or onset at the age of around 18. Number two is severe manic symptoms persisting up to 7 days in a row and may require hospitalization. And number three, usually bipolar 1 disorder can be characterized by mania only and no depression, but it could be both as well. Okay, so mainly mania persisting up to 7 days and onset around 18 years of age. Now, a person with bipolar 2 disorder will experience episodes of both major depression and hypomania. The symptoms of hypomania are the same as mania, but they are less severe and only last up to 4 days rather than a week. Cyclothymia, which is the third type of bipolar, can begin as early as 6 years of age and may eventually develop into bipolar 1 or 2. So basically, we can say that cyclothymia is child onset of bipolar. A person with a cyclothymia disorder will experience hypomanic and depressive symptoms, but never to the extent that they qualify as mania or major depression. So cyclothymia, what is the difference of cyclothymia from bipolar 1 and 2 is that it usually can begin as early as 6 years of age, while bipolar 1 and bipolar 2 usually don't. And cyclothymia can actually turn into bipolar 1 or bipolar 2, or can remain as cyclothymia, which means that the patient will still have manic symptoms and depressive symptoms, but not regarded as major depression or major mania, just a bit of hypomania and just a bit of depressive symptoms. There is no single cause of bipolar disorder. The research shows that it may be related to several factors such as genetics. When I read the excerpt for you from Bipolar Australia, that also said that it is related to genetics. A person's environment, the triggering factors could be environmental factors like stress and all, or like illness, and brain structure. It is common for people with bipolar disorder to have the other mental health diagnosis such as psychosis, anxiety disorders, eating disorders, substance or alcohol use disorder, because these people experience a lot of changes in mood and behavior. They can go very easily into substance abuse. Bipolar disorder is a lifelong mental health condition, but with the help of treatment provided by psychiatrists and then coordinated by the GPs, it is possible to reduce and manage the symptoms. Bipolar disorder is usually treated with a combination of medication and psychotherapy. So it's the same as ADHD, in which the preference is to treat the condition with psychotherapy and medications. But what medications are used for bipolar, we'll talk about it later.